When a beloved animal companion receives the diagnosis of a terminal disease, or they have a chronic or incurable illness that's affecting their quality of life, it is so common for their human loved ones to just feel really lost and confused because they have no idea what to expect. You can educate yourself so that you know what might happen and you can plan for the future. You just need to take 3 steps. The first thing you do is talk to your veterinarian. So find out what your pet has been diagnosed with. Step 2 is to take that diagnosis and figure out which common pathway that falls into so that you have a roadmap for what might lie ahead. Step 3 is to discuss with your veterinarian what you can do to improve your pet's comfort and quality of life right now and in the future when things change. There are 4 common pathways that pets tend to follow when they have diseases at the end of their life. We're going to go through those one by one right now. But first, I want to talk about function. So, when I'm talking about daily function, I'm talking about your pet being able to do the things that get them through the day, being able to go out and potty or use the litter box, eating and drinking, but also doing those things that bring them joy and happiness in life. So, the first pathway that we will talk about is sudden death. This one's pretty straightforward. What it means is that your pet is functioning at a fairly high level, and then something catastrophic happens within their body, and then they die suddenly. The example I always think about with this one is my husband's 92-year-old neighbor who was at the top of his ladder painting his house, and he had a stroke and he died shortly thereafter. So he was functioning at a very high level, and then he suddenly had something happen and he died. Fortunately, this is not very common in companion animals, but it does occasionally happen. The second pathway is cancer. So, patients that have cancer often maintain pretty good function for a variable period of time. And then suddenly the cancer starts to grow very rapidly or take over certain body systems, and they can decline very suddenly and rapidly. This can happen over a period of weeks or days, and I've even seen it happen over in a matter of hours. So, with my cancer patients, I always make sure that the family is aware that things can change very rapidly and without warning. The third type of pathway is the one that goes along with what we call the degenerative diseases. So these are things, they tend to affect things like the bones and joints, or the spine, or the nervous system. So, some diagnoses that your pet may have received that would fall in this category would be things like cognitive dysfunction, intervertebral disc disease, or your vet may have called that like a slip disc or a herniated disc. Degenerative myelopathy is one that's pretty common, and probably the most common of all of them is osteoarthritis. Arthritis is very, very common in older pets. So, what happens with these pets that have degenerative diseases, or what we might refer to as frailty, is that very slowly, over a long period of time, they're gradually losing function until eventually it's so hard for them to get through their day that their family feels like they have to make a euthanasia decision because their quality of life is no longer any good. And let me tell you, I think these are the situations that are the hardest for families because their pet doesn't necessarily have something that's going to end their life, and the family's forced to take on that decision to make euthanasia for compassionate reasons. And it can be so hard to know when to draw that line because it happens so gradually. If this is your situation, just know you are not alone in this. It's hard for everybody. The final pathway is one that goes along with organ failure. So, organ failure may be a diagnosis of something like congestive heart failure, which is the end stage of many heart diseases. Another common one is liver failure or chronic kidney disease. So, the end stage of chronic kidney disease is kidney failure. With these conditions, the patient's declining and functioning pretty gradually and steadily over time, a little bit faster than they would with frailty. But the difference is they tend to have a lot of ups and downs. So their condition might suddenly get worse for a few days. They might get treatment, or even without treatment, sometimes they'll bounce back and do a little bit better, but not quite as well as they were before. So the overall trend is downward, but there are a lot of ups and downs in between, and that can be pretty confusing for the family. Eventually, they do decline rapidly and then they don't bounce back, but it's hard to know exactly which time that's going to be. So, again, the four common pathways are sudden death, cancer, the degenerative conditions, and finally, organ failure. Once you know which category your pet's disease condition falls into, then you can go back to your veterinarian and make a plan for how to treat their comfort and well being now and also in the future when their condition changes. My name is Carolyn Naun, and I am the owner and medical director of Arms of Aloha, where we believe that every pet deserves peace, comfort, and dignity at the end of their life. If you want to learn more about how we can support you, you can visit us at armsofaloha.com. And if you have other ideas of topics you'd like to hear me talk about, or you have questions about what I told you today, please drop me a note in the comments section. Mahalo.